Hi, I'm Lanaya.
And I'm Riley.
And the topic that we chose to discuss today are the oral manifestations and effects of pregnancy. So we can start over here. The most common condition found in the oral cavity of a pregnant person is pregnancy gingivitis. Signs of gingivitis include redness, inflammation, and irritation of the gums. And the reason why it's most common during, or not most common, but it arises during pregnancy is because during pregnancy there's a lot of hormone changes. So over here we talk about hormone changes. So the increased progesterone can boost your blood flow in your gums and tissues. Therefore, that blood flow creates more bleeding, sensitivity, swelling. And then the estrogen changes also allow our gums to react to bacteria more, and it's more vulnerable to inflammation as well due to those changes. Plaque buildup can also have a contribution to pregnancy gingivitis. So due to the hormone changes, the gum tissue is more reactive to the plaque buildup. So if plaque builds up, the gums are more likely to be irritated because of all the hormone changes. All right, and then if the plaque is not removed, like we said, it can lead to the gums being irritated. The way we can manage this condition is just by continuing to practice our oral hygiene at home, our brushing and flossing, and then it's also important that we're also getting our professional cleanings done while pregnant. Even though we're pregnant, we can still get our dental cleanings done. And then if if gingivitis is not treated, it can progress into periodontal disease, which is the same as gingivitis but more in-depth as it's related to bone loss and more supporting structures are affected during periodontal disease. And periodontal disease during pregnancy is very important because pregnancy, if you have periodontal disease, it can affect both you and the uterus. So if periodontal disease is not controlled during pregnancy, it can lead to preterm birth and also low birth weight of the of the fetus. So prevention of periodontal disease is the same as gingivitis. We want to make sure we're brushing, flossing every day, doing our daily oral hygiene, and as mentioned, we want to get our oral professional cleanings done.
Okay, so next we're going to talk about the pyogenic granuloma, which is also known as the pregnancy tumor. It's a non-cancerous growth that normally happens during the second trimester, and it's usually painless and soft, and it looks normally like this. It can be purple, pink, or red. If it is painless, the tumor, we can surgically remove it, or it can be usually results after pregnancy and with good oral care. Next is erosion that normally happens during the first trimester due to morning sickness and vomiting. It creates frequent acid in the mouth that causes the inside of the teeth, mostly on the maxillary, to become like a stained yellow-brown color, and also thinning of the enamel. That's due to the acid, and something to help prevent that is to avoid brushing right after vomiting for at least 30 minutes, just to avoid brushing the acid around to other surfaces. And then next we have caries. Pregnant women are more prone to caries and tooth sensitivity due to the very acidic and sugary diet that they have, due to abnormal food cravings, and also just more eating snacks and cravings in moderation can help with that. Rinsing with water or milk after snacking to help neutralize the acid in the mouth. And also, if dental work does need to happen, the safest time to do treatment is the second trimester. And lidocaine and prilocaine are the local anesthetics that are the most safest during pregnancy, and that is category B.
Alright, those are some of the oral manifestations of pregnancy. Are there any questions?
Thank you.